For nearly a century, children and families throughout our region and the world have benefited from the innovative thinking made possible by academic medicine. As Minnesota's first children's hospital, we've been breaking new ground in cures and care for mothers and children for nearly 100 years. And now we're breaking ground once again, this time in a whole new way. Opening in 2011, the new University of Minnesota Amplatz Children's Hospital will ensure that you and your children have access to leading healthcare and new thinking, all in a world-class, state-of-the-art hospital. The new facility will be an ecologically friendly 350,000 square foot structure with over 200 beds, consolidating our 50 pediatric specialties into one patient and family-centered location.
First of all, I think it's going to be terrific to be able to provide patients and families the space they need to heal sooner. It's our job. That's what we're there for in the first place. And secondly, I think we'll finally provide our staff the space that they need to do an even better job than they're doing right now. I think that combination is really winnable.
A facility that, because it's connected with the Academic Health Center, we do some things that only facilities connected with research can do.
The new facility will replace the current hospital within a hospital configuration and unite pediatric and maternal services in one family-friendly location. It also will house some of the country's leading clinical programs, including programs in pediatric organ transplantation, blood and marrow transplantation, cancer treatment, and heart surgery. We're very proud of the features of our new hospital, which were created with input from our young patients and their families.
For them to be able to weigh in on what would make a difference in a long stay was crucial for us, and some of the size considerations and some of the things that are in the room today are the result of those sorts of dialogues with families and patients.
Each 390 square foot private patient-friendly room will offer families and medical staff 75% more space than the standard hospital room. These larger rooms offer privacy and will allow parents to comfortably stay with their child, prepare meals, and catch up on work. Featuring state-of-the-art technology, the rooms will include bedside controls to allow the child control over his or her environment. The rooms will include refrigerators and microwaves and the ability for medical devices to be hidden from view to make the room a home away from home. Outside of our rooms, patients find even more amenities. The Family Resource Center, which will provide accessibility to the health information parents can use to make informed healthcare decisions. A children's playroom. A family kitchen and laundry. The design of each pediatric floor will feature an animal habitat theme such as the desert, grasslands, and the ocean, which aims to make the hospital a more enjoyable and imaginative place to visit. Our hospital also features a pediatric hybrid catheterization lab, which enables pediatric cardiologists to repair a hole in the heart without resorting to open heart surgery. If surgery is needed, however, it can be done immediately in the same room without having to schedule another surgery. Our pediatric intensive care unit is one of the first in the United States dedicated exclusively to the care of critically ill children. Bed placement in these rooms will give our medical staff 360-degree access to patients at all times. The new hospital will feature a dedicated pediatric emergency department, including 8 children's emergency rooms and 2 trauma bays. The new hospital building will be green, incorporating an environmentally sensitive design, eco-friendly materials, and green spaces, such as a healing garden. Our mission is to be the leading source of hope and healing for children, adolescents, and their families from Minnesota and across the nation. In support of this mission, we provide the highest quality of healthcare for all children through innovative research and delivery of new knowledge for the care of children, the education of the next generation of care providers, and the practice of patient and family-centered care.
Nobody wants to have their child in the hospital. So the best job that we can do is to have that patient in the hospital and out of the hospital as quickly as possible and as close to being healed as possible. And that's what I'd want them to know. We listened.
To learn more about the new University of Minnesota Amplatz Children's Hospital facility, visit uofmchildrenshospital.org/new hospital.